Hi, I'm Maddie Angus, and this is our measles virus presentation. So we're first going to start off by talking about the history of measles virus. So the first account was discovered in the 9th century by a Persian doctor, and then in 1757, a Scottish physician named Francis Home discovered that it was caused by an infectious agent in the blood. So measles began to become more common and more of a problem until 1912, when the U.S. decided that they needed to record all the measles cases. And by doing this, in the first decade alone, they recorded 6,000 deaths a year. And so it was pretty common for kids to get measles before 1963. Almost every child before they turned 15 had measles. And 3 to 4 million people in the U.S. alone were infected each year. And about 500 died, and 48,000 were hospitalized, and 4,000 suffered encephalitis, which is swelling of the brain. Okay, and then John F. Enders first isolated the virus in a patient in 1954 and worked on developing a vaccine until he released it in 1963. And it was pretty strong. And so it wasn't the most common vaccine given, and this was called the Edmundston B strain of measles virus. Then, 5 years later, Maurice Hilleman released a less strong and improved vaccine for measles, and this was called the Edmundston Enders strain, and the U.S. still uses this vaccine to this day. So in 1978, the CDC set a goal to eliminate measles by 1982. However, this goal was not met, but each year the rates were reduced. And during this time, measles vaccine was usually combined with the mumps and rubella vaccine, so it's commonly called the MMR vaccine, or it can be combined as well with varicella, so it can be called the MMRV vaccine. And so with that, the reports of measles began to drop each year, and then physicians decided in the 90s that it was a good idea to give a second dose of the vaccine to children, and this led to the elimination of measles in the year 2000.
Hi, I'm Kim Brighton, and I'm going to go over the signs and symptoms of measles. The symptoms of measles usually appear about 7 to 14 days after a person is infected. These symptoms include high fever, runny nose, sneezing, sore throat, cough, swollen lymph nodes. You get tired, diarrhea, red sore eyes, red spots inside your mouth, and you get the rash all over your body. A fever may get as high as 104 degrees, and then after only a few days, the fever subsides and the rash fades away. These are some of the spots that you can see inside your mouth. They're actually called the Koplik spots, and in your red watery eyes is called conjunctivitis. Here are some pictures of the rash that you get over your body. It is also called maculopapular, and it appears 3 to 5 days after the original symptoms begin. The incubation period is 7 to 14 days. During this incubation period, the measles invades a host cell, most commonly in the monocytes and the lymphocytes. The measles virus invades into the host cell by attaching to a few different types of receptor proteins located on the cell wall. Once invaded, the host cells carrying the measles virus travel through the body via the blood and lymphatic systems, where they land infecting various organs such as the skin and eyes. The virus further replicates and continues to invade more cells, resulting in various symptoms like the rash, the redness in the eyes, and the spots in the mouth. Clinical symptoms and signs of measles can be ambiguous at times, so the most definitive method of diagnosing measles is performing either a blood test or a viral culture. When doing a blood test, we use either a plain red tube or a serum separator tube to do the blood testing. A type of blood test to diagnose measles is a serological assay, which means we are looking at the serum of the blood. We are trying to detect the presence of IgM or IgG, measles antibodies, within the serum of the blood. Therefore, this is an indirect assay since we are not measuring the actual viral load, but rather viral presence via the antibodies. High specificity of these tests means that the test correctly identifies the disease. The IgM is short, fast responding antibodies developed after initial exposure to the virus or vaccine. But the IgG are long, slow responding antibodies which are formed after exposure and stay for a life to provide immunity to the virus. The next is to do the blood culture. To diagnose measles is to do a blood culture. Often culture isn't used for diagnosing, but rather a virus surveillance, which is a way to say we are tracking to see if the same or similar viruses are spreading throughout the communities.
Hi, I'm Brad Baird, and I will be doing my section on the etiology and transmission of the measles virus. The measles virus is a single-stranded, negative-sense enveloped RNA virus, which that just means the negative sense aspect of it means that the virus has to be changed into a positive sense RNA virus before it can be translated. And the genus of the virus is the morbillivirus, and it's within the family of the Paramoxiviridae family. And then the reservoir for the measles virus is humans. No animal reservoirs are known to exist. And then as far as transmission goes, the measles virus is very contagious. It has an attack rate of 90%. So 9 out of 10 people who are in contact with it will be infected with it. And it occurs through contact or through airborne. And if you look at the picture I have right there, it kind of can show you how contagious it is and how far it can go. It shows the Ebola virus, once those particles go airborne, go about 3 feet, and the measles virus goes well past 6 feet. And the infectious droplets that are secreted from a patient with measles can remain in the air for up to 2 hours. So a person doesn't even, who's infected with measles doesn't even have to be there to infect other people. It can be transmitted in public places. There's been reports of airplane passengers outbreaks, having an outbreak of measles, and also in crowded areas such as schools and densely populated communities. Oops. The risk factors for this are children with immunodeficiency due to HIV or AIDS, or leukemia, alkylated agents, or corticosteroid therapies, regardless of the immunization status. And then also people who travel to areas within measles endemic or are in contact with travelers to these areas are at risk of getting it. And also infants who lose the passive antibody before the age of their routine immunization are at risk of receiving measles.
Hi, I'm Marielle, and I'm going to talk about the treatment and prevention of measles. Okay, so much like the flu or the common cold, measles usually disappear after 2 to 3 weeks on its own, and has many of the same treatments that doctors usually recommend to help treat the virus. So what doctors usually recommend if someone has already contracted the measles virus is acetaminophen, which is used to try to relieve their fever, to lower their fever at and to help with the muscle aches that come. Lots of rest, fluids, a humidifier, and vitamin A supplements. Vitamin A helps fight off the measles virus, causing the supplements to be crucial in the recovery. Because the more vitamin A in your system, the faster you'll be rid of the virus, and the less vitamin A in your body, the more susceptible one is to the virus. One of the positives, I guess you could say, about the measles is that once you've had the virus in your system, you are no longer susceptible to it. So you can only get the measles virus once. The MMR vaccine that we talked about before, the MMR stands for measles, mumps, and rubella, is a vaccine that they created. It's a series of 2 shots. The first shot is administered at the age of 1, and the second shot is administered anytime between the ages of 4 and 6. The shot usually has no side effects other than a sore arm from the shot and temporary stiffness. There are a few rare side effects that can happen. There's not a whole lot of them reported, but the side effects are seizures, deafness, brain damage, and sometimes even coma. But like I said, those are very extremely rare and don't happen in most cases. The vaccine is very important because a lot of the times the measles themselves are not what are so deadly to the people that contract the measles virus. What is so deadly is what happens once you've have the measles, because your body is so susceptible to other things. Measles can especially lead to pneumonia and encephalitis, which are the leading causes of the deaths of measles, and can have a big effect. So here are our closing statements. The measles virus is very dangerous and can lead to life-threatening complications. Thankfully, there is a vaccine that prevents the virus, and thankfully modern science has given us it as a preventative. That way, we can ensure that less people have to suffer from contracting the virus and have to suffer from the complications that come, like that pneumonia and like that encephalitis. Because it was such a problem in the early 1900s, it was, and I think it still is, the leading cause of death in children. The Mayo Clinic reported most of the victims are under the age of 5, and there's more than 114,900 deaths. Even though measles is not as common as it used to be, the CDC reported 189 cases just in 2005. So having the vaccine and using that vaccination to prevent contracting this virus is something that we should take advantage of, because it's so easily available to us and accessible. We should take advantage of it, especially since it has such low risk factors and of those side effects, and can help prevent us from contracting that measles virus and leading to those complications that lead to death.